The hair is thick, full, evenly distributed. There's no bumps on her skull. That's symmetrical. Look at your skin. The skin is warm. The color is appropriate for her ethnicity. There's no phenomena. Look at your neck. Palpitate your carotid arteries. Those are both 2+, and now I'm
So I'm palpating the skull again, trying to feel any deformities that I might not have seen. Looking for any pattern hair loss. Very thick hair. Next, going to palpate on the chin and cheeks. I don't feel any bumps or masses. Very good. And I'm just going to look at the symmetry of the ears. And finally, I'm going to come and assess her lymph nodes. These turn towards me. Okay. We're going to palpate every lymph node, and your lymph nodes should be soft and untender if you feel them at all. They should be able to move under your fingers. Okay? You should not feel any firmness, any swelling, and the patient should have no pain when you're palpating this. Any of these symptoms could mean things like lymphedema, HIV, infection. Okay? So we're going to start with the preauricular, postauricular, occipital, which is back by the base of the skull, the parotid, which is over the parotid gland, the submandibular, which is under the mandible bone, and submental under the chin. Then we have the superficial cervical chain, the deep cervical chain, the posterior cervical chain, and supraclavicular, and the tonsillar. Okay. So all of these lymph nodes are named for where they're located on the body. So for example, preauricular is in front of the ear, postauricular in the back, occipital along your occipital bone, superficial cervical chain on the light part of the neck, deep, you're just going a little bit deeper for palpation, posterior cervical chain along the back of the neck, supraclavicular, which is above the clavicle, submandibular under the mandible, and submental under the chin. And like I said before, your parotid, which is your parotid gland. Okay? So her lymph nodes feel fine. Do they cause any pain? No. So no tenderness noted. I don't have any swelling. They all feel movable. I don't feel many of them, which is a good sign.
The first lymph nodes I want to feel are the preauricular lymph nodes, which we find just in front of the ear. The postauricular lymph nodes are just behind the ear. The occipital lymph nodes are at the posterior base of the skull on either side. Frequently in children under the age of 2 will find that these are enlarged, and that is normal for them. The tonsillar lymph nodes are at the angle of the mandible, just on the anterior edge of the sternocleidomastoid muscle, which runs along here. So if you had tonsillitis or enlarged tonsils, perhaps we would feel tonsillar nodes there. The submandibular lymph nodes are just on the medial border of the mandible, and the submental lymph node is just at the very tip of the mandible. And then we move down, and those are the lymph nodes really in your head, and we move down into your neck. And the first ones that we want to feel for, you have the sternocleidomastoid muscle here, and you have the trapezius muscle here. And we just want to feel the superficial cervical nodes, which are just superficial to the sternocleidomastoid muscle. And then we want to feel the posterior cervical nodes, which are going to be posterior to the sternocleidomastoid muscle and yet anterior to the trapezius muscle, to see if we feel any lymph nodes there. The deep cervical chain, which is also down here, is deep within and around this sternocleidomastoid muscle. So we usually palpate a little bit deeper to try to feel those lymph nodes. And the last lymph nodes to feel would be the supraclavicular nodes. That's good. You can see you've had this done before, and I just feel here it's between the clavicle and the sternocleidomastoid muscle. And that's it. Palpate your trachea here to see if it's midline, and it is. And the other thing that I want to do is to palpate for your hyoid bone, your thyroid cartilage, and your cricoid cartilage. And we call the thyroid cartilage, you may be more familiar with it being called the Adam's apple. So I just want you to take a sip of water and swallow. And And what I can feel is I can feel everything move up as you swallow, which is very normal.
Good. The head is normal size and shape, no lumps or bumps, no dandruff, and no lesions or moles. All right, good. Now we're going to go to your face. Face looks good, just a little dry. It looks like you've had a little bit of acne that's clearing up now, and I know you told the nurse that. Let's see, next we're going to look at the rest of you. We're going to go to your back. Back is also even in skin tone, dry and warm to touch and intact. Go down to your legs. Everything looks good there all the way to your feet. Skin tone's even. Okay, very good. Next we're gonna, as I go back, I'm gonna go back kind of up to your face because I didn't look at your eyebrows good. I wanted to check them out. They're symmetrical, same size on each side. They're brown, they match your hair color. Your eyelashes are also the same color. Look into your eyes, there's no bulging, there's no redness around your eyes, no edema. I'm gonna look at your conjunctiva. And your blood vessels, everything looks good. No redness, no edema. Everything looks good. Now we're going to go to your nails. And we're going to check capillary refill. Capillary refill is good, less than 3 seconds, and there's no clubbing or cyanosis. We're also going to check your toes for the same thing. No clubbing or cyanosis in the toes. Capillary refill is also less than 3 seconds. Now we're going to
feel around your head first. I'm just feeling for any lumps or bumps or anything like that. Any head injuries that you've had? No? Okay. Any tenderness when I'm touching your head? No. Good. I'm going to feel your temporal lobes here. And this side. Any pressure when I push there, or tenderness? No. Okay. How about here? No. No. Go ahead and open your jaw for me and bite down. And then open again and put your bottom jaw left to right. Any tenderness when you do that? I feel your lymph nodes, okay? So I'm going to start here, and if you feel any tenderness in any of the spots that are pressed, just let me know. And on both arms, I'm going to check your lymph nodes here. Any tenderness anywhere? No. And then we'll do this side. Good. Just give me a minute here. Alright, go ahead and take a drink. And then look up for me a little bit and drink again. Good. I'm just going to be measuring your jugular venous pressure here. Okay. Listen. I'm just going to lift this here a little bit. Good. And the other side.
Cents. To do this, hold the sides of the patient's big toe with your thumb and index finger. Avoid touching the other toes.
Now, can you
First,
tell me up
move
or
it
down?
up and down, identifying each position as the patient watches. Next, ask the patient to close his eyes and identify the direction of motion. Then, move the big toe up and down in an irregular sequence. Compare with the big toe on the other foot. In a similar fashion, test position sense in the upper extremities using a finger on each hand.
Yep. 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 Yep.
En dit is strekken.
Ja.
En als u mag dan zeggen of ik uw duim buig of strek.
Oké.
Mag ik de ogen dicht doen?
Buigen. Strekken. Buigen.
Prima.
Oké.
Ik ga zo met uw duim bewegen. Dan mag u zeggen of ik uw duim buig of strek.
Oké.
Mag de ogen sluiten?
Buigen. Buigen. Strekken.
Prima. Doe hetzelfde met de pols. Mag u zeggen of uw hand naar u toe komt of van u af beweegt. Even.
Naar me toe. Naar me toe. Van me af.
Ga naar de elleboog. Mag u zeggen of uw elleboog.
And I'm going to move it in a position. You have to tell me which position it's in. So this is up and this is down. Okay? So have you close your eyes?
Up, down, down, up, down.
Good. Now I'm going to do the same thing. Put your hand over here. Same thing with your finger.
Okay.
Okay? So this is up and this is down.
Okay.
Okay? Close your eyes.
Up, up, down, up, down.
Good. Do the same thing with this wrist. So I have the wrist in my hand like this, and this is up
Okay.
and down.
Okay.
Okay. Ready?
Okay.
Close your eyes.
Up, up, down, up, down, down.
Good. Now go and test your finger.
Okay.
This is up, and this is down.
Okay.
Close your eyes.
Up, down, 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 up, down.
Good. Now I'm going. So this is up, and this is down. Close your eyes.
Down, down, up, down, down, up.
Good. Same thing on this side. Alright. This is up, and this is down. Have you close your eyes?
Okay. Up, down, down, up, down, up.
Good. And big toe. This is up, and this is down. Close your eyes.
Up, up, down, down, up.
Head is hard and smooth. Hair is black, short, evenly distributed on the scalp, and it's clean. Great. Good. And I'm going to palpate the lymph nodes, the pre-auricular, the post-auricular, the maxilla, mandible, the supraclavicular. I'm going to palpate the trachea. Trachea is in midline. We're going to do the temporal pulse, which is at the temporal artery. The carotid pulse, which is at the carotid artery. But make sure you do that one at a time or you can restrict blood flow to the brain. We don't need that. Carotid pulses are strong.
Patient is tested by asking the patient if he's been touched in one or two areas. Using two ends of an opened paper clip or the sides of two pins, repeatedly touch the patient's finger pad with the 2 points at the same time and with 1 point occasionally. Ask the patient to identify if he's being touched with 1 or 2 points. Then reduce the distance between the points so that you can determine the minimum distance at which the patient can identify 2 points. On the finger pad, the distance should be less than 5 millimeters.
Tell me what this feels like on your toe.
Vibration.
All right, and I have my finger located under her toe because I can feel vibration through her toe and into my finger, so I know there still is some vibratory sense present there, or vibration present. And I can ask Mary, now Mary, you feel vibration?
Yes.
And then tell me when it stops.
Stop.
Okay, so I've checked vibratory sense and her ability to sense when it stops as well. Now I'll do the same thing on the right side, and Mary, keep your eyes closed. And I'll touch on the distal edge of the toe here, just behind the toenail. And Mary, what does this feel like?
Vibration.
All right, and tell me when it stops.
Stop.
All right, so she notices when it stops as well, so vibratory sense is intact. I'll check joint position sense. And Mary, you can look at your toe here. What I'm going to do is I'm going to move your toe either up or down,
Okay.
and I'm going to be much more subtle with that than what you noticed there. But if you can close your eyes,
Okay.
and then tell me whether I'm moving the toe up or down.
Down. Up.
And notice I have my fingers just on the outside of the toe. I don't want to apply pressure like this because Mary would be able to tell there's pressure of movement up and down. Instead, I'm moving the toe away a little bit and moving it up or down this way. Now I'll check on the other side. And close your eyes again, and then tell me whether you feel me move it up or down.
Down. Down.
Okay, and so
So first of all, I'm going to assess dorsiflexion. Good, strength is 5 out of 5. And then plantar flexion. Good. And then assessing the toes. Extension, good. And flexion.
The first metatarsal phalangeal joint and see how much extension we got there. So it looks like Gonzalo's got about, I'd say about 60 degrees. Again, we got to measure this to make sure. Maximum great toe dorsiflexion needed during gait is 55 to 90 degrees. Compensation can lead to excessive weight bearing on the lateral metatarsal heads, and associated stress fractures along the lateral metatarsal heads and the fifth ray can develop if there's an avoidance of that first metatarsal weight bearing. We also can have potential posterior tibialis tendinitis if the
Glands on the sides of the cheeks, and then put your chin up for any swelling right here of the salivary glands and any swelling here at the base of the neck for the thyroid gland. All right, that are the collarbones, and you want to put your fingers right in here, and can you shrug your shoulders up? There you go, right into that hollow right there is where you would feel those. Okay, you can tilt your head down a little bit. Feel the skin on your back, look for any moles.
Ask you to first tilt your head forward a little. Okay, so now in the neck we have the hyoid bone, you have the thyroid cartilage, then the thyroid gland, and it connects to your trachea. So for here, I'm going to ask you to take a sip of water and hold it for now. I'll tell you when to swallow it. Okay, so tilt your head to the left, please. Okay, and swallow. Okay, now keeping your head tilted forward, I'm going to ask you to take another sip of water.
This time you're going to tilt to your right and swallow. Okay, so I note no masses. Everything's fine. This is the pre-auricular, the post-auricular, the tonsillar right here, occipital's back here, submandibular, submental. Then we're going to start going down to the superficial cervical, the deep cervical, and the posterior cervical. And the last one that we'll do.
Manually palpate the lymph nodes, starting at the submental lymph node area. She will then move back and bilaterally palpate the submandibular lymph node, facial lymph nodes, pre-auricular lymph nodes, parotid lymph nodes, post-auricular lymph nodes, and occipital lymph nodes. At this point, the clinician will then cup the client's chin and turn it to one side. She will then locate the sternocleidomastoid muscle and identify the anterior and posterior cervical chain areas. She will then palpate along this muscle. Once this is done, she will then palpate the supraclavicle lymph nodes. Then she will cup the client's chin and move it to the other side, repeating the same step. Next, she will locate and manually palpate the thyroid gland. If felt, further examine it by gently pushing it on one side of the gland by using bilateral palpating, the opposite side and vice versa. Bilateral palpation is used to examine the temporomandibular joint area by performing the following. Place the index and middle fingers in front of the tragus of the ear, instructing the client to open and close several times slowly. Instructing the client to move from side to side several times. Instructing the client to move.
C6 again is down in the thumbs.
Yep, same.
C7 middle finger.
Same.
C8 little finger.
Same.
And T1 will be over the medial aspect of the elbow.
Same.
Okay, good. And then we'll move down into the lower extremities again. Starting with L2, anterior thigh.
Same.
L3, medial knee.
Same.
L4 over the medial malleolus of the ankle.
Same.
L5, dorsal foot.
Same.
And then S1 over the lateral aspect of the heel. Over the lateral aspect of the heel. For this portion of the exam again, we'll have the patient close his eyes. And when we grab our finger to test, what we want to make sure to do is grab on the sides of the fingers so we don't give any inadvertent clues that might come through pressure over the bottom or the top where the finger pads are particularly sensitive, as opposed to on the outside. Then what we're going to do is we're going to have the finger in a nice neutral position, and we're going to wiggle the joint either up or down and ask the patient to tell us whether or not he feels his position is now up or down. So starting in a neutral position, and we'll ask him now.
Up.
And then again.
Down.
Return it to neutral and then move to another spot.
Down.